Welcome to Roadmap to Residency. Hello everyone, I am Abhiraz. Welcome to our Club 250 Maths Micro Sessions. We will be running through some questions with you guys to help you on our journey to a 250. So, which of the following is the most appropriate next step in the management of this patient? A 45-year-old male presents with persistent left hip pain and discomfort. He reports a dull ache that has been progressively worsening over the past few months. Physical examination reveals limited range of motion in the left hip joint and tenderness over the greater trochanter. Radiographs demonstrate a lytic lesion with stippled calcification in the proximal femur. MRI confirms the presence of an expansile lobulated mass with cortical involvement. A biopsy is performed and histopathological examination reveals chondroid matrix and atypical chondrocytes, consistent with chondrosarcoma. Now, which of the following is the most appropriate next step in the management of this patient? Observation with serial imaging, radiation therapy, core biopsy for further characterization, surgical resection, or chemotherapy. So, surgical resection. Chondrosarcoma is a malignant tumor of cartilaginous origin that tends to occur in the adult population, typically between the ages of 30 and 60. The tumor often arises in the pelvis, proximal long bones, and the shoulder girdle. In this case, the patient presentation of persistent hip pain, limited range of motion, and imaging findings of a lytic lesion with stippled calcifications is consistent with chondrosarcoma. The most appropriate next step in the management of chondrosarcoma is surgical resection. Complete surgical resection with negative margins is the primary treatment modality for localized disease. Chondrosarcomas are less responsive to irradiation and chemotherapy, so surgery is the cornerstone of curative therapy. Now let's talk about osteosarcoma and chondrosarcoma. So the osteosarcoma accounts for 20% of the primary bone cancers, and it is located in the metaphysis of the long bones, often in the knee region. The peak incidence is in males less than 20 years and less common in the older adults, usually secondary to predisposing factors such as patient disease of the bone infarcts, radiation, familial retinoblastoma, and Leigh-Freeman syndrome. The characteristics of osteosarcoma are a pleomorphic osteoproducing cell, which is called as the malignant osteoblast, which presents as a painful enlarging mass or pathological fractures, Codman triangle from elevation of the periosteum and sunburst pattern on the X-ray. Aggressive primary are usually responsive to treatment like surgery and chemotherapy, and there is poor prognosis for secondary sort of osteosarcoma. The chondrosarcoma most commonly occurs in adults more than 50 years old, and the location is the medulla of the pelvis, proximal femur, and humerus. The tumor of the malignant chondrocyte is chondrosarcoma. The lytic is present in more than 50% of the cases with intralesional calcification, endosteal erosion, and cortex bleach. Then you can see the typical presentations of the chondro and osteosarcoma. Now let's talk about the pathological fractures. So pathological fracture usually occurs with normal activities, and the patients may be doing very routine activities when their bone suddenly fractures. The reason is that the underlying disease processes weakens the bone to the point where the bone is unable to perform its normal function, and it can affect any bone in the body. Here you can see this is the pathological fracture. This one here is the pathological fracture. So the prostate cancer has an affinity to metastasize to the bone. So the recent research has revitalized the Paget's soil and seed theory of metastasis. So the bone matrix is called as the soil. These recent factors that stimulate the growth of tumor cells. The tumor cells here are the seed. So it promotes the both metastasis and the bone pathology. Once in the marrow, the metastatic cells take advantage of normal marrow physiology to survive and grow away from the primary tumor. Metastatic cells also cause dysregulation and release of cytokines and other factors present in the bone marrow. Now, which tumors have a predisposition to the other sides? So the lung cancer, breast cancer, melanoma, and renal carcinoma, colorectal cancer have metastasis to the brain. Where when we talk about the bone metastases, the breast cancer, prostate cancer, lung cancer, melanoma, renal cell carcinoma, and thyroid carcinoma have a predisposition to metastasize to the bone. So we have again one more question. So 16-year-old adolescent presents with persistent pain and swelling in the right knee. Physical examination reveals a palpable mass over the distal femur. Radiographs show a mixed lytic and sclerotic lesion with aggressive periosteal reaction. MRI demonstrates soft tissue extension. Biopsy confirms the diagnosis of osteosarcoma, which is the most appropriate next step in the management of this patient. Neoadjuvant chemotherapy, limb amputation, radiation therapy, corneal biopsy for further characterization, observation with serial imaging. So neoadjuvant chemotherapy. So osteosarcoma is the most common primary malignant prone tumor in adolescents and young adults, frequently occurring around the knee. The classic radiographic appearance includes a mixed lytic and sclerotic lesion with aggressive periosteal reaction, and often described as a sunburst pattern. The soft tissue extension is common and biopsy is required for definitive diagnosis. The most appropriate next step in the management of osteosarcoma is neoadjuvant chemotherapy. Osteosarcoma is an aggressive malignancy with a high propensity of early metastasis, and neoadjuvant chemotherapy is used to reduce the size of the tumor, treat micrometastatic disease, and facilitate the surgical resection. It has been shown to improve the overall survival rates. Thanks for watching.